Dr. Philip Ovadia. Is that how you say your last name? Ovadia?
Ovadia.
Ovadia. Okay, where is that from? Yep. Where's your what's your heritage?
Yeah, the name's actually a Hebrew name. It's a common first name in Israel and in the Old Testament. So that's
Okay.
the background.
Well, you can tell my lack of knowledge there then. um, well, Dr. Ovadia, I appreciate you doing this. For the listeners, awareness, can you let them know what your field of expertise is and what you have been doing for the latter part of your life?
Yeah, sure thing, Jonathan. So my background, my professional background is that I am a heart surgeon, a cardiac surgeon, and I have spent the last 20 years operating on people who have advanced heart disease. And during much of that time, I was progressively unhealthy myself. And I found myself at a place about 7 years ago where I was morbidly obese, I was pre-diabetic, and I kind of realized that I was going to end up on my own operating table, so to speak. I was also at a loss of what to do because I had been following the advice that I had learned to give my patients and I had learned would make me healthy. All the standard advice around eat less, move more, eat a low-fat diet, follow the food pyramid. And it wasn't working for me. It wasn't working for my patients. And I started asking some different questions and I started coming across some different information. And I figured out, how to become healthy. And that was for myself first. And then I realized that this could be helping my patients as well. And, I started talking to them about these things and saw good results in them. And ultimately what I came to realize is that heart disease is largely preventable. And the vast majority of people who end up on my operating table didn't need to be there. The medical system, the healthcare system had failed them. And I, have a new mission, an additional mission, I guess, to keep people off my operating table, to teach them how to avoid the need for heart surgery. Because, no matter how good a heart surgeon I may be, no matter how good all the heart surgeons out there are, you're never as good after you have heart surgery as you would have been if you never needed heart surgery in the first place, if you never got heart disease in the first place. So I think prevention is the best strategy here. And I think I know that everyone has the power within themselves with the right education and with the right guidance to maximize their health and to prevent heart disease. So that's been my focus as of late.
Oh, I appreciate that. I also appreciate how honest you are about being overweight and having. I noticed that you call it metabolic syndrome, and I want to get into that, but I want to focus on a little bit like how you became so unhealthy, because that's not an uncommon thing that most average Americans who are going to doctors for medical advice and for health advice to see overweight doctors and out of shape doctors. And even there's some fitness trainers that are considered fitness influencers on Instagram that are, out of shape considerably. So how did that come to fruition with the background that you had in health?
Yeah, that's a great question. To go back to my childhood, and I was obese all throughout my childhood, but my family, followed the guidelines as they were. I have an older brother who is a type 1 diabetic, so we didn't have sugar in the house. We ate all of the low-fat products that we were told were healthy for us. We drank skim milk on our cereal every morning, our Wheaties and our Cheerios, our low sugar cereals. We had, margarine instead of butter. And I would say we ate, pretty much in line with the US dietary guidelines. A lot of carbohydrate, a lot of packaged and processed foods. And I was also very active, which is supposed to be the other part of the equation. We're all told, oh, we're all getting fat because we're not active enough. Well, I played sports year round. I would ride my bike to my friend's house and to school and be out and around the neighborhood. This was in the internet era. So we were outside playing, whenever we could. And yet, despite that, I became, I was obese as a child. It got worse as I went through college, medical school, very stressful times in life, going through medical school. You don't sleep well, you don't sleep enough. You're eating a lot of your food in the hospital. And ironically, that's not good for your health. It's just a lot of stress. So all of that starts to add up. But you're right. Doctors, nurses, healthcare professionals, they're no different than the population at large when you look at their health. And the sad reality is that our population is sick. 88% of the adults in the United States are not metabolically healthy. And as you said, we're going to talk a little bit more about what that means. But the reality is that most people are sick. That's why the healthcare system is so overwhelmed. And it's gotten to a point now where the healthcare system doesn't have the time to focus on people being healthy because they're so overwhelmed taking care of sick people. And it just isn't the focus of the healthcare system, quite honestly. So I believe that that's why we have become so sick. Our food supply, our whole environment just contributes to us not being healthy. And we need to start doing something to change that.
What is there ever going to come a time when the education system, because I talked to Dr. Saldivar. I don't know if you've seen her on Instagram, but she's a professor in Miami, and I think she's a nutrition professor. And I asked her this question too, and she didn't have a sunny, flowery answer. But when is our education system going to change? Because it seems like we're still teaching stuff that is over a few decades old when it comes to nutrition and health. On Instagram, you're seeing more and more people talk about the animal-based diet, the carnivore-based diet, and things like that, but it's not really filtering into the education system. Will that ever happen?
The honest answer is, I don't know if it's ever going to happen. Systems, institutions are slow to change. And, that's for many different reasons. It's just, there's a lot to do there if we want to change things on the institutional level. But each one of us individually has the power to change. And that ultimately is what I focus on. The people who seek me out, the people who find me, the people that I'm able to connect to, each have the power within themselves to change. And the more and more of us that are doing that, and there are more and more of us that are doing it, more doctors, more healthcare professionals of all sorts that are focusing on it and are spreading the word, are dispersing this information so that more and more individuals can take the initiative. And ultimately, I think this is going to be a ground up movement. Because when more and more individuals are focused on this type of stuff, then the corporations, the institutions, they'll start to respond to that. But to wait for the institutions to change, I think is the wrong approach. Because quite frankly, the institutions that we're talking about, the healthcare system, the pharmaceutical industry, the food industry, they don't have any incentive to change. It's working great for them. Right. They're profitable. They're busy. The system works exactly as they want it to work. The system is not working well for us as individuals who are becoming more and more sick. And that's why we, the individuals, need to start making the changes.
Yeah, I fully agree. I love the information on your website, and I love how it details your backstory that we just kind of briefly covered. You mentioned metabolic syndrome. Can we talk about that? Explain what that is, because it's not just a one thing. My understanding, it's a multitude of symptoms or diseases that can impact somebody. So what is metabolic syndrome?
Right. So, the metabolic syndrome and metabolic health is really at the root cause of most of the chronic diseases that we face. Things like heart disease, diabetes, stroke, Alzheimer's disease, many forms of cancer. These have all been related to the metabolic syndrome. So it's important that people understand what it is, how to measure it. Because one of the other issues that we have around our health is that most doctors aren't measuring the right things. They're not looking at the right things. Many people make assumptions about their health based on things like their weight. And they say, well, I'm not overweight. I'm not that overweight. So I'm healthy. I'm not having I'm not having chest pains. I'm not overtly diabetic. So I'm healthy. But metabolic syndrome really underlies our health problems, and therefore it's important to know what it is and how to measure it. And what the metabolic syndrome is basically a constellation of numbers, tests, measurements that we look at to determine if your body is working the way it should, if your body is properly processing all of the inputs that you're giving it, and these are mostly in the form of the food that we eat. So specifically, when we're determining if someone, is metabolically healthy, if they have the metabolic syndrome or not, we look at 5 measurements. The first measurement is something you can and should check at home. It's your waist circumference. Very easy. All you need is a tape measure. You measure just above the level of your belly button. First thing in the morning is the best time to measure it. And if you are male, you want that to be less than 40 inches. If you are female, you want it to be less than 35 inches. The next measurement is your blood pressure. You can also check this at home, get a home blood pressure cuff. Almost every pharmacy, grocery store, has a little kiosk these days that you can go and get it checked. And pretty much every time you go and see a doctor, you're going to get your blood pressure checked. And the goal there is for your blood pressure to be less than 130/85 without the use of medications. If you've been told that you have high blood pressure and you've been started on medication for that, that's an indicator that you are not metabolically healthy. The final 3 measurements come from some basic blood work. And again, this is common blood work that you're going to get checked as part of a routine physical. You can go online to many websites these days and request it, check it yourself if your doctor hasn't ordered it for you. You want to look at your fasting blood glucose level, the amount of sugar that's in your blood when you haven't eaten for about 8 to 12 hours. And that should be less than 100 milligrams per deciliter, which is the units here in the United States. And again, that needs to be without the use of medication. So if you've been diagnosed with type 2 diabetes, if you've been, started on medication to lower your blood sugar, another indication that you are not metabolically healthy. And then finally, we look at the cholesterol panel. And, cholesterol seems to be what everyone talks about these days. Every time you go to the doctor, they're going to talk about your cholesterol level. The thing is, when most doctors refer to your cholesterol level, they're referring to one number on that panel, your LDL, low density lipoprotein cholesterol, what they'll call your bad cholesterol. Turns out that that number does not relate to your metabolic health. We don't look at it. We look at 2 other numbers from that panel that tell us about your metabolic health. We look at your HDL cholesterol, what's always called the good cholesterol. And it's called the good cholesterol because you actually want more of it. This is confusing to a lot of people because they're always heard you got to have your cholesterol lower. But HDL cholesterol, you actually want higher. Specifically, if you are a man, you want it to be over 40 milligrams per deciliter. If you are a woman, you want it to be over 50 milligrams per deciliter. And then finally, we look at your triglyceride level. And this one, you do want to be lower The official criteria is less than 150 milligrams per deciliter. So you look at those five numbers, and if three or more of those are outside the healthy range, you are diagnosed with the metabolic syndrome. It's actually a medical diagnosis. And what it means is that you are at high risk of developing all those other things that I talked about: heart disease, stroke, Alzheimer's disease, many forms of cancer, all related to the metabolic syndrome. So it's very important to check those numbers. Now, I referred to a statistic earlier. This comes from a study, looking at adults in the United States. The data is actually from 2016, so it's older. And at that time, 88% of the adults in the United States could not meet all five criteria of metabolic health. So in other words, only 12%, about 1 in 10 of us, is in optimal metabolic health. And there have been other studies that suggest that the numbers have gotten even worse since then.
Do you know any?
Go
ahead.
I was going to say one other important part of that data, however, is that just because you are not obese, you are not overweight, it doesn't mean that you are metabolically healthy. In that study, the people who were considered normal weight, only 45% of them were metabolically healthy. So in other words, more than half of the normal weight people are not metabolically healthy. And that's an important, assumption that is wrong. That is, if you are not overweight, you are therefore healthy.
Do you know any statistics comparing the United States to other countries? I imagine other countries are a little healthier than the United States.
Yeah, it does vary country to country, and a lot of it has to do with, the types of food that they're eating. But what you see, the consistent pattern that we do see is as countries, as societies get more westernized, they adopt the American diet, they get more processed food, they become unhealthier, metabolically unhealthier. And that is a very clear and consistent pattern that we see.
That's so scary. Can you, I have in my family, diabetes runs rampant in my family. And we, my family consumes large amounts of seed oils, stuff in a box, stuff in a bag. And I personally try to keep that stuff out of my house just because I know that it's not good for you and I know it doesn't make you feel good. But diabetes is definitely a factor in my family and across many other families. And I've seen some folks on social media talking about how diabetes can be reversed. Is that possible?
Yes. So type 2 diabetes, we're talking about specifically. And yes, it certainly can be reversed. And, I myself, in the patients I work with, have seen it many times. The other practitioners that I talk with in the metabolic health space, same thing. We actually have a good amount of published data. The largest probably series looking at this comes from Ovadia Hearth, which is a organization that focuses on reversing type 2 diabetes with diet and lifestyle interventions. And they have shown their program to be quite successful. Over 60% of their participants at 2 years have reversed their diabetes, meaning that they have normal blood sugar levels off of medications. So it is possible. And everyone with type 2 diabetes needs to get that message. Because again, it's not the common messaging that we have in healthcare. The common thinking about type 2 diabetes is it can only be managed with medications and that it's a progressive disease. It's going to get worse over time. But we now have very good evidence showing that it can be reversed. Diet and lifestyle interventions are the way to do that. And, if you have type 2 diabetes, if anyone in your family has type 2 diabetes, that is an important message. And then you need to seek out the help from the, healthcare professionals that can help you to do that.
All right, so help me out, doctor. I'm ignorant. Is type 1 the worst, or is type 2 the worst?
So, it turns out that there are basically two different diseases that end up at the same place. So, diabetes is viewed as having high blood glucose. That's sort of the end result of it. Type 1 diabetics don't make insulin. So, insulin is the hormone that our body uses to control our blood sugar levels. And type 1 diabetics don't make insulin. Usually comes on during, childhood, although it can come on later in life. Type 2 diabetics make a lot of insulin that their body isn't responding to. They become what's called insulin resistant. So their body is making lots and lots of insulin, but their cells aren't responding to it. And this is one of the end products of poor metabolic health. And so they end up with a high blood glucose level as well. So both of the types of diabetes end up with high blood glucose level, but they actually come from exactly opposite problems. And, that becomes interesting because one of the ways that we oftentimes treat type 2 diabetes is by giving insulin, even though there's already an excess of insulin, which is a little, doesn't quite make logical sense. But that's what we do in the healthcare system. And instead, for both forms of diabetes, but especially for type 2 diabetes, if you just stop consuming so much carbohydrate, you stop putting so much sugar into the system, you can control and potentially reverse it. Type 1 diabetes is not reversible because the body just doesn't make insulin. You can control it a lot better still with low carbohydrate diets. And many people with type 1 diabetes, have great success with low carbohydrate diets, but it's really not reversible because we haven't found any way to get the body to, start making insulin.
Interesting. Okay. I appreciate that clarification. Does diabetes, in fact, is it a family gene that gets passed on from generation to generation, or or is that a misconception?
Yeah, there may be a genetic predisposition to it, but it's not truly a genetic disease. And it turns out the reason that diabetes seems to, run in families and we think it's genetic is because families tend to have the same habits. They tend to eat the same foods, and those habits get passed on generation to generation. So it's not truly a genetic disease. There are some, genetic influences is the way I usually explain it to people that might make you more prone to diabetes, more likely to develop type 2 diabetes. But it's not truly genetic. And therefore, no one is destined to get type 2 diabetes. I think everyone has the power, again, to, make these diet and lifestyle changes and prevent themselves from getting diabetes if they seem to be at higher risk for it, or, start to reverse it and improve it.
Does the same go for heart disease as well? Because I know there's a lot of families that typically, well, I guess it's about the same. If your family has a problem with diabetes, and they probably have a heart history as well. But is that the same? Can we look at diabetes and heart conditions the same?
Yeah, largely so. So, type 2 diabetes is one of the biggest risk factors for heart disease. So you're right. They do tend to go together. And again, heart disease seems to run in many families, but it's not truly genetic. There are some rare genetic conditions that do, predispose you to developing heart disease. But for the most part, the reason that, so many people seem to have heart disease is because, again, we are so metabolically unhealthy, and that is so common. And, the families that have the habits that predispose to this, it's going to seem that heart disease runs in those families, but it's the habits. It's really not genetics.
Okay. So what's the one thing, if there's one thing that someone who's metabolically unhealthy can do? Processed food or seed oils? or sugar, I guess. Yeah, I guess it's those three things: processed food, sugar, and then seed oils. What's the number one culprit of those three?
So, what's interesting about that question is they really all go together. Processed food, eliminating processed food is the first step, is the best step to take. I tell people, rather than looking at it as eliminating processed food, I just tell people to eat whole, real food. But when you eliminate processed food, when you look at the vast majority of processed food, when you look at all of those things in the center part of the supermarket, it's all largely the same stuff. It's got different colors, it's got different flavorings, but it's a combination of highly processed carbohydrates, sugar in many forms, and fake oils, vegetable and seed oils. Both of them are highly processed. It's hard to determine, honestly, which one is causing it, or whether they're both causing it. If you eliminate the processed food, you're going to eliminate both of those things largely from your diets, and you're going to see improved metabolic health. There's biochemical reasons to look at each one and think why they may be causing the problems. The vegetable and seed oils, the high omega-6 polyunsaturated fatty acids that are in those vegetable and seed oils in such high concentrations, on a cellular level, do many things to mess up our metabolic machinery. Sugar has been around in our environment for quite a long time. And when we were, historically eating just low levels of sugar, and especially kind of natural sugars and things like fruits, it didn't seem to be a problem. More recently, it's become a problem because we're eating so much more of it. And we're getting it in such high concentrations, and we're getting it from non-natural sources. I think both of them are problematic. And ultimately, what I tell people to do is just eat whole, real food, and that is going to improve your metabolic health.
Can you talk about what the vegetable oils or the seed oils do and how they impact your body when we consume them? Because I'm pretty ignorant to it. I listen to Carnivore MD and some other folks on social media, but I think a lot of people don't realize what those chemicals do to your body and how they impact you.
Yeah. So, without getting too deep in the woods, realize that fatty acids, are make up, a large portion of our bodies. All of the structure of our cells, the cell walls, as they're called, are, built from these fatty acids. In the mitochondria, which are sort of the power plants of the cell, again, these fatty acids are playing a part in the actual making of the energy. And the problem with vegetable and seed oils, or I should, more technically say the problem with unsaturated fatty acids, polyunsaturated fatty acids, which are in a large proportion in these vegetable and seed oils, is that they are unstable and they can get easily damaged, what we call oxidation. Oxidation, many people, the way that we see oxidation is rust. When metal gets oxidized, it rusts. When these fatty acids get oxidized, they become rancid. They become damaged. So if you ever have left a bottle of vegetable or seed oil out on the counter, and you'll know after a couple of days it smells bad and it turns, color, and it is, it's rancid. Well, that happens inside our bodies. So the more of these polyunsaturated fatty acids that you're consuming, the more they're incorporated into all of your cells, and then they are prone to getting damaged. And that damage is ultimately what leads to the metabolic syndrome.
I heard something crazy that the seed oils and vegetable oils have a half-life of like 10 years or something like that.
So, if they are processed enough, you can get them to be, shelf stable. And what you might be referring to is studies that have looked at, how long it takes once these things are incorporated into the cells of your body. How long does it take to get them out?
Right.
Is probably what you're referring to. And it does take a long time. So they've done biopsies of people's fat, and they've looked at, the fatty acids. And what we see is that these polyunsaturated fatty acids, once they're incorporated into your fat cells, can take many, many years to get them out of your fat cells, even if you stop, consuming vegetable and seed oils. So, that is a concern. And unfortunately, that's why it can take a long time for people to get healthy. If you have been unhealthy for a long time, it can take an extended period of time to get you back to optimal health. But it is a gradual process. And the sooner you start, you're going to first stop damaging your body, and then you're going to start improving your body. And again, a very important concept there. If we just stop doing damage to our body, we're going to get better over time. The body has an amazing capacity to heal itself in all sorts of disease conditions. But the first step is you got to stop doing the damage.
Yeah. I feel like Alex Jones in my family sometimes because I eat mainly meat, fruit, ate a lot of eggs, a lot of Kerrygold butter. And when Alex Jones was going around telling everybody about Jeffrey Epstein and everyone's calling him a conspiracy theorist, that's the way I feel in my family when I'm trying to explain, like, hey, no, this is better. Like, eat butter, eat more butter, and eat more animal fats and more fruit instead of the processed foods. But it's like it's almost a no-win situation to tell people that butter is not bad, to choose beef tallow over, olive oil and things like that. How do you do it, and what kind of success do you get from your message?
Yeah, so you're exactly right, and it goes back to that problem of everyone around us is unhealthy. So when you start, pointing that out, when you start telling people you actually can be healthy, you don't need to be on, multiple medications when you get older. You sound kind of crazy because they look around and they say, well, no, everyone around me is on multiple medications and everyone around me is unhealthy. And the problem is that they don't make that connection to the diet. This messaging of, low fat and, these processed foods are better for you is so pervasive in our society that people don't step back and think about it. They don't step back and think about, we have been eating animal products for our entire existence as human beings. How would it make sense that we evolved on a certain food and that food is unhealthy for us? But people don't think about that because, the messaging is all around us that meat is unhealthy for you. And it's simply not true. So it becomes challenging. Ultimately, you can't force this change on people, no more than you can force them to quit smoking or other things which are obviously unhealthy for our health. People have to want to do it for themselves. They need to do it for themselves. And I believe the best way of doing that is just modeling the good behavior. If you're showing up to your family events and you're looking better and you're healthier and you're, obviously have improved your life, you have more energy, you're just more present and you're not sick, and you're not falling asleep after the family dinner like most people do, hopefully the people around you are going to start saying, I want that too. Let me figure out what he's doing.
I'm curious what your diet looks like. What are you eating and consuming, and also drinking too? Because I don't know if what your thoughts are on coffee and alcohol and things like that. But what does a week look like for you?
Yeah, so I, for the past, so my journey really started about 7 years ago, and I went through an evolution of getting kind of lower and lower carb, a more traditional ketogenic diet. And about 3.5 years ago, I started, carnivore. And I've stuck with it because it works great for me. Importantly, I don't think it's the only way to do it. It's what works best for me, and so I've stuck with it. So and I'm not dogmatic about it. I'm not going to stand here and say I never eat a non-animal product. But 95% plus of what I eat is animal products, meat of all sort. I eat a good amount of seafood. I eat a lot of eggs. In terms of drinks, it's pretty much water, coffee. I do occasionally consume low carbohydrate alcohol. So those are things like bourbon, vodka, tequila, gin. Bourbon is probably my preferred drink. But non-alcoholic drinks, it's coffee. And it's typically either black coffee or I'll sometimes put salt in my coffee to get some electrolytes. I'll sometimes put some butter or some coconut oil in my coffee. If I kind of want the energy from fat, and I'm not eating fat at that time, during my fasting windows or whatever. And that's what works best for me. That's what I feel best on. And also, it's a simpler, kind of lifestyle when you don't really have to think much about what you want to eat, when you just have a refrigerator full of meat and you can go and you can pull something out and you can, throw it on the grill or throw it in a cast iron skillet for a few minutes and you're eating, and minimal mess, minimal cleanup, no waste. It just works on all fronts for me.
What are your thoughts about animal organs, liver in particular? Because that's exploded on social media as well, and a lot of people are eating raw liver or just raw organs in general. Are there any benefits to that? And do you lose anything whenever you cook those?
I think organs have higher concentrations of a lot of nutrients, and therefore, especially for people who are still recovering their health, they can be beneficial. I don't think they're essential. I know many people who rarely or never eat organs on a carnivore, animal-based type diet, and they're doing great. They're very healthy. You can get all of the nutrients that you need from, the meat, from the muscle meat itself. I do think having some variety, eggs, for instance, they have everything in there that ultimately becomes a chicken or becomes a duck. They have a very well-rounded nutritional profile. So I think incorporating something like eggs in the diet can be very beneficial. Some people would even say that's sort of an organ. But if you like organs, if you want to consume them, if they're available to you, I do think they are a very nutritious food to eat. They're very nutrient dense. Honestly, I don't think that the raw versus cooked makes all that much of a difference. It just depends on, what's going to be palatable to you. One of the ways that I oftentimes incorporate organs into my diet is getting it mixed into my ground beef. You can have your butcher do that. There are a number of places online that you can order, organ blends, or they're sometimes called primal blends. And, they'll have some organs in the ground beef, and that's a good way to get it in if you don't like eating these things directly.
That's a good idea, because I try to consume raw liver 2 to 3 times a week, and I gotta tell you, man, I hate it. It don't even really taste that bad, but it just leaves like an aftertaste it's not very welcoming. I try to put maple syrup on it and salt, but I don't look forward to it, I guess. But I feel a little different mentally, and maybe it's a placebo effect or something, but I definitely feel something when I consume it. I don't know what that is, but
Yeah, like I said, I think it certainly is. The organs are very nutrient dense. And so I think, you can almost think of them as nature's multivitamin. But like I said, I know many people who, maintain animal-based diets for long periods of time without organ meats, and they're doing just fine too. So I don't consider it to be essential.
yeah. I was just talking to a buddy this morning, and, living your life as optimal as possible. Eating healthy, exercising, at least 3 or 4 times a day a week. And now there's this doing saunas and cold plunging and grounding every day, making sure you're getting sun. It's a lot to deal with. And if you have kids and if you have, if you're in school or if you work full time, it's kind of overwhelming. Have you done any, what's your thoughts on cold plunging and sauna? Like if there's one that's greater than the other or anything that's outside of exercise and diet, what would you recommend for somebody?
Yeah. So, first and foremost, I think, it is clear that diet is the most important part of this. And just changing your diet is going to have vast impact on your health. I would put exercise and activity next. That is going to get you a large part of the way. That's probably 90, 95+% of this. There are a lot of other things. What I would put next on that list is going to be sleep, getting adequate sleep. And good quality sleep is important. So, exercise, activity, sleep, stress management comes next for me. It's not that you're eliminating the stress in your life. We all lead very stressful lives. It's just having a good way to deal with that stress. And that can be your community, that can be religion, that can be meditation. For some people, exercise is part of that. It helps to relieve stress. Those are probably the big four for me. The rest of it, if you want to try it, great. We have an infrared sauna at our house. It feels good. You sweat out some toxins. I think it's beneficial. But the mistake that I see too many people making is that they're doing all this biohacking stuff and they're still eating a crappy diet. And, you're not going to get very far doing that. You're not going to get the results from all these other, things that you're trying any more so than, if you're just taking medication to try and control your type 2 diabetes, but you're still eating all the sugar and carbohydrates, you're not going to have very good outcomes. So diet really has to come first. And then as much of the other stuff you can do. But ultimately, you're right. You have to live your life. If you're doing all this stuff at the cost of, then you're not interacting with your family. You're not present for your children, or you're not able to, keep up with your job. Again, you're not going to end up in a very good place. So it all needs to be prioritized. But diet is really the first, is really at the top of what you got to be focusing on.
When did you, so your book is Stay Off My Operating Table. Is that the title of it?
Yes, that's the title of the book.
Well, how long ago did you write it and what was the inspiration? Was it right after you kind of discovered this new health journey that you were on and where can people get it at?
Yeah, so the book came out, November 2021, so about 8 months ago at the time we're recording this. It's widely available, Amazon, all the other online markets. You can go to my website, ovadiahearthhealth.com, and there's a link there to it as well. The inspiration was really that, I can only work with so many people one-on-one. And this information needs to get to as many people as possible. The book was the best vehicle for me to do that. And, I have lots of people who write to me. They comment on social media. They leave their reviews on Amazon, that they read the book and it changed their life. They got healthy just by following the advice in the book. I tried to keep the book very, practical. But one of the things I don't do in the book is I don't give you the Dr. Ovadia 28-day diet plan because the reality is that there is no one right diet for everyone. I give you the guide, the framework, to figure out for yourself, is it a keto diet? Is it a carnivore diet? it can be for some people a vegan diet, that eliminates processed food. You need to supplement on the vegan diet, but you can be a metabolically healthy vegan. I know many people that are. I work with some clients that are. You need to find what works best for you. The book, I think, is a very good guide to help you get there. And again, it goes deeper into what is metabolic health. It goes through all those measurements we talk about, so that you can be, doing this yourself if you can't find someone else to help you do it.
No, that's great. I definitely plan on picking that up. I have a list of books that I'm working through right now. The debate between vegan and carnivore or animal-based is, I kind of get sucked in there a little bit, but at the end of the day, I realize that what the vegans are, they truly want to help the world, and they have a caring heart for protecting animals. But the bigger thing, like you said, is if they're healthy. But yeah, I mean, all the power to them. I think everyone is different, and everyone's going to have a diet that works for them. I know they're out there, and I know that they can maintain the vegan lifestyle long term. So I'm glad you work with a couple of them as well.
Yeah, again, what I looked at is, what is the commonality between, animal-based carnivore diet and a, plant-based diet, a healthy plant-based diet, and the distinction there is eliminating processed food. The trap, I would say, that many vegans fall into is they end up eating a lot of processed food. All of this fake meat is highly processed, not good for your health. It has a lot, oftentimes has vegetable and seed oils, and just the chemical processing that it undergoes, to create those products is not beneficial for our health. The other problem, the other fact about a vegan diet is you cannot get certain essential nutrients from plant products. It's just a human physiologic fact. So if you're going to do that, if you're going to be completely plant-based, you need to take supplements to make up for that. And if that's the way you choose to live your life, like I said, all the power to you. I fully support it. And I work with many vegans, and we figure out a way to make it work for them. But as I alluded to earlier, we evolved as humans eating animal products, and animal products are not the problem leading to our poor health.
Well, Dr. Ovadia, I appreciate your time. It's an honor, and I can't wait to put this one out.
Thanks for having me on, Jonathan.
Yep, I'll let you know when this one comes out, and you have a good day, Doctor.
All right, thank you.
Thank you. Appreciate it.